Hi, this is Leslie Ziegler coming to you live from the Digital Health Summer Summit at UCSF, and I am sitting here with Bill Evans, who is the president of Bridge Design. Hi, Bill.
Hi.
How are you doing?
Fine.
So, as a designer, this is clearly something that's near and dear to my heart, both, is in terms of my professional background and also my recent experience as a patient. I have this terrible boot, had to go through a couple of weeks of crutches, and it is wonderful to understand a little bit about what you guys are doing at Bridge and know that there are people out there trying to make better products for patients. So can you talk a little bit about the company and the problems you solve?
Well, Bridge Design, the company I founded, specializes in medical products, and we've come to the digital world through the device world. Back 20 years ago, there wasn't much digital, but increasingly people have been carrying what we called mobile digital interfaces, which weren't connected to the cloud. Go back 15 years, we did an insulin pump for Smith's Medical Cosmo, which had to really talk to the person. It was pretty much like a digital product. And I think what's increasingly happened is we've been asked more and more over the last few years to design products that were in the ecosystem type of thing. They're connecting devices to perhaps an app, to perhaps a cloud app, where a company is really trying to grapple with improving care, improving outcomes, and lowering costs by connecting those things. So we're finding we're doing a lot of work more in digital, but also in a lot of devices that use information technology in interesting ways. So it doesn't always have to be a mobile type of situation. So.
Got it. Yeah. So, what were you up here talking about today? What was the panel about? What was maybe one thing that people who weren't able to come may have missed?
Well, what I was talking about today was about what is the worth of your technology to users and to the system. And my angle, of course, as a designer focused on usability and customer appeal is what is it worth to a user? How do you determine some of the very valuable things to that user? And whilst it's obvious to those of us who've come from the user-centered design world, it's not as obvious to people coming from tech about how important it is to use the best practices in user-centered design to really dig in and understand what it means at the point of care and at self-care sometimes, to really understand what it's going to take to make your product move the needle and actually have an impact on the treatment, say, a chronic disease, or even something for a healthcare professional to find more useful. And I think one of the things I took today as my sort of take-home point is that sometimes as an app developer or a web app developer, you've got to ask yourself the question, not can my users use the technology, which often is easy to test in a lab or something, but it's more, will my users use that technology? How can I get them to actually want to adopt it, be drawn in, and feel it's a useful thing to them? And those are difficult things to do, and it's things like making that technology seamless for people to use, so they don't have to worry about hooking anything up or connecting on Bluetooth, so that it's really something that can just fit in with their lives with a minimum of effort. And then the other thing is to really make the information that you're presenting to users, again, whether they're patients or healthcare people, make that actionable data that really makes a difference to them at the point of care or self-care.
Fantastic. So if people wanted to come in and procure your services or just follow what you're following, where are you online? Twitter, Instagram. What's the best way?
Well, online it's bridgedesign.com. That's obviously a good place to look. But we also have a Twitter account which is Bridge Design SF that they can follow us on there. So I think if you look around, I get around. I speak at a lot of conferences and write for various sources and so on. So I think there's a lot of opportunities to just Google Bridge Design, medical product design, and you'll find us.
Fantastic. Well, thank you so much for being here today.
Thanks a lot.